Mary Mary Kompuche.
Mary Mary Kompuche. I'm greeting you in my mother tongue. My name is Maria Quiñelen in the civil registry as ID, but my name is what you just heard, the voice of the goddess singing in the waters. This is what determined my work as midwife. I am Mapuche. I am in the south cone of America in Chile, an indigenous community that has been there prior to Columbus. I am a midwife. More than 1,301 were born through my help in the pathway to life. I have a long-standing tradition in my family, knowledge that come from the Mapuche community, which embraces all of the southern part of Chile. I do have a school of indigenous medicine, which follows our cultural knowledge. I am a live example of the situation affecting us. And this is because of the state decision of the academia and the Western medicine, whether worldwide or just in the Americas. I'd like to share with you some examples of indigenous midwifery so that you can see how this happens in real life. Midwife is not just being a midwife, it's not just a health service. It's connected to culture. Every human being, every group of human beings do have a culture and they inhabit a territory. Midwifery, as I said, is not just health services. We are connected to land, to climate, to seasons, to the ups and downs of water courses, to the heat waves. Midwifery is not just a health service. It is a connected system, connected to our knowledge, to astronomy. I mean, we do have a name for all of the constellations, the 13 constellations that exist. Epunauk, Ponyi, interpreter apologizes for the repetition, Namunchoiki, the three Mary or the Orion's belt, because midwifery is not just a health service, is, as I said, connected to governance, connected to administration, governed by somebody who thinks, a woman who has a brain and a knowledge and is educated in peace. She's the warrior in discovering where the best food is, where the trees are, where the birds are nesting. Because midwifery is not just, again, a health service. It is a connected system, connected to community relationships. Our communities, indigenous communities, are at the moment governed by an oppressing colonial system. And we, the indigenous midwives, are the carriers and the bearers of knowledge that has gone generation after generation. And our knowledge about birth is incredible. Not just about the birth of human beings. We're just one little tiny part of the healing process. We have medicine that comes from centuries of trial and error, because we are a nation that pre-existed. We, the indigenous midwives, are the carriers and the bearers of the knowledge coming from plants. And because everything that gets sick does have a medicine on earth to heal, midwifery is a right. The right of women, indigenous women, to decide how birth occurs, how life comes, with actions, with prayers, with rituals, reading the placenta, reading the day the baby's coming. I mean, all of that depends on all of the knowledge system that we've been upholding for years. Human rights, human virtues, ancestral practices. This is not simply Western resources. Our hands are enough. The knowledge held in our hands is enough. And this entitles us to be midwives according to indigenous knowledge, with no subordination to external models. Today, indigenous midwifery not only is practiced, but is upheld and defended, because the conditions permitting our existence are governed by multiple decisions outside our world, like health regulations. Let's go to the sources and the origins of a disease so we can heal with earth, with words, with fire, with land. We have legal framework, but we also have our framework. If you are creating damage, you cannot continue governing. You have to go back to the masters of knowledge. We have education systems. Ever since we are born, this is transmitted through words, through silence. We have environmental policies to restore health through the seeds, through our plants, and we also have access to earth, to soil, and to land. Even before 200 years ago, those systems of domination got to our place, we were nomadic. The Mapuche people went all over the place. I am still a nomad. I've been here for a week, then I'll go to Argentina, then I'll go to Chile. I'm still nomadic. And I go wherever birth occurs and wherever labor occurs. And those systems should be aligned with health, education, the environment, earth, health. Midwifery is directly impacted by mercury, lead, contamination of water, plastic everywhere. When the systems, the legal systems, are not acknowledging our existence, our practices are restricted, even criminalized, prosecuted. Every time I get involved in labor, the parents have to go to the civil registry to register the names, and they have to wait for 3 months to get a birth certificate. Little respect is paid to my certificate, where I say, this was the mother, this was the baby, this is how the baby was born. Civil registry is threatening my parents and tell them, you will be arrested. You will be arrested. This is what is happening. You and your midwife, you will all be arrested. And there we are. You know, we have to tell them you need to wait for 90 days to get your birth certificate. When these systems are working that way, excluding indigenous traditional medicine, knowledge is marginalized. When access to soil is restricted, we lose access to plants, to medicine, to water sources, to streams, to lakes. And when biodiversity is undermined, our own medicine disappears, and we have to travel further and further away in search of our plants. Remember where the blossoming is occurring. I am also the guardian of seeds for medicinal plants that are no longer flowering where I live. So decisions made away from us are affecting very negatively the results and the outcome of birth and labor. This is what we are seeing in all of the reports. When the midwife system is weakened, impact is immediate on mother's health, in mother's milk, in the scarring of the uterus, in the baby's skin, in the health of each and every member of the family. This has an impact of babies' health when there is lack of care, lack of guidance in education. Community is impacted if the baby is not doing okay, the family is not doing okay, and community is not doing great. intergeneration knowledge has to be transmitted. We are further and further away from our culture, from our territories. But also, we have to say that when everything is aligned, Indigenous midwifery is supported, traditional medicine is respected, and the earth and the biodiversity are protected. And when that happens, we have a nation that is protected and in good status physically, mentally, and spiritually. The outcome for the health is wonderful. Communities are reinforced, strengthened, knowledge is preserved. It's good life for everyone. And the permanent care will persist, respected and paid homage to. So Indigenous midwifery shows something very important. Indigenous health does not improve just with one single action. It's boosted when systems work together, respecting one another with no fragmentation. And through our health, through the environment, through governance, and through culture, the moon culture, our own calendar, all of that will help us to continue preserving our health. We have schools that have been there for centuries. We have medicine that has been there for centuries. We have a word that's been there for centuries. Our midwives have been there for centuries. Millenniums, allowing us to see the connection, acting upon all of those axes. Why do we have to come to the UN over and over? And we come to Jeffrey, who is allowing us the space to talk. So my warmest greetings from the Continental Alliance of Indigenous Midwives, encompassing most of the countries in North America, Central America, and South America. Good life to your Indigenous peoples and to all of you.